Hi beautiful people, you're welcome to another exciting one on your favorite show, Nes Ika Show, and I remain your favorite host, Nes Ika. Today we are going to be looking at something very interesting that not only affects elderly men but equally affects young growing men. I believe that you know someone who might be suffering from what we are about to talk about today. Therefore, you may want to share this video so that others can benefit and learn from it too. Now, we will be looking at nothing else than erectile dysfunction. Do you know that more than 10 million Americans suffer from erectile dysfunction? What would you say if I told you that 1 out of every 4 men you see has a problem with erectile dysfunction? Yes, that is how huge the problem is. Therefore, there is a need for you and I to address this issue today. On today's video, we'll be looking at erectile dysfunction. We'll be looking at everything that has to do with erectile dysfunction. And don't forget that I always bring you tips on how to manage such problems. Because on Nes Ika Show, we bring you health tips. Now, when you hear erectile dysfunction, what comes to your mind? Simply, erectile dysfunction can be defined as an inability to have an erection or an inability to maintain an erect penis during sexual intercourse. What are some of the causes of this erectile dysfunction? I want you to know that erectile dysfunction does not only affect the elderly men, but can affect even men who are less than 40 years. Yes, science has shown that at all stages of our lives as men, we can have erectile dysfunction. So we'll be looking at some of the causes of this erectile dysfunction, and then you will be able to agree with me that it can affect men of all ages. What are some of these causes that can cause a man to suffer from erectile dysfunction? You can have health problems, health challenges like diseases such as diabetes, like hypertension. You can have all of those diseases that is going to affect your reproductive system. You can also have problems like emotional stress. Some of us go through relationship problems, some of us are anxious, we suffer from anxiety, depression, and all of that affects our libido, or it affects our sexual drive. Also, for some of us who take tobacco or cigarette has an effect, a negative effect on our erection. Now, we also realize that if you have experienced a rapid weight gain within a short period of time, that if you're obese, for instance, you may also suffer from erectile dysfunction. If you consume a lot of alcohol, you would also suffer from erectile dysfunction. Now, before we go to some of the signs and symptoms of erectile dysfunction, I want you to understand the mechanism, because if you understand how erectile dysfunction or how an erection comes about, then you'll be able to understand these causes and you'll be able to understand the symptoms and the management for this problem. Now, an erection can be stimulated by maybe our thoughts or direct stimulation of the penile tissue or of the penis. Okay. Now, when the penis is stimulated, there is a muscle in the penile tissue that relaxes. And once this muscle relaxes, blood flows into the penile tissue. When blood flows into the penile tissue, the veins constrict, preventing this blood from going out of the penile tissue. And that rush in of blood into the penis is what causes an erection. Now, if you suffer from an erectile dysfunction, it simply means that this blood rushes into the penis, but the muscle contracts so fast that you're unable to maintain this erection. Do you understand? Okay, I hope that's simple enough. Now, what are some of the signs and symptoms, or how do you know that as a man or as a lady, how can you tell that your man is experiencing erectile dysfunction? The first thing is that he may have premature ejaculation. Another thing that he may experience is delayed ejaculation. And sometimes some men may complain, or they may tell you that they do not attain orgasm. Those are some of the signs and symptoms of erectile dysfunction. Remember that we have mentioned a few causes of erectile dysfunction, such as alcoholism, tobacco use, lack of adequate sleep. We have also mentioned obesity, diseases like diabetes, hypertension. We have also seen things like lack of exercise or sedentary lifestyles. Now, just from the causes, you will be able to think, or you would agree with me, that the management of this problem depends on the underlying cause. Let's take for instance that you have problems because you've had a sudden weight gain over the last few months or years, and then now you experience erectile dysfunction. What is going to be the solution? You may want to start trying to consider exercises that you do so that you can lose weight. You may also want to incorporate healthy eating habits or healthy diets into your you may want to incorporate healthy eating habits. You may want to start putting more vegetables in your diet, more of fruits, more of protein, and less of carbohydrate. Now, for those of us, maybe we experience erectile dysfunction because we have hypertension or diabetes, the solution is going to be to treat this disease and keep it to the minimum level. That's your sugar level. You have to do whatever it takes. In our subsequent videos, we'll be telling you on tips on how to manage diabetes, hypertension, but you need to know that you need to keep your sugar level at a base so that it's going to limit the occurrences of this erectile dysfunction. For those of us who are suffering from emotional distress, like anxiety, depression, you may want to practice some of the stress management techniques. In some of our videos, we have looked at the stress management techniques, so you may want to go back to some of our videos to look at what you may need to do so that you can fight this problem of erectile dysfunction. Then, for those of us who consume alcohol, you may want to start considering consuming alcohol moderately. Then, for those who take cigarette, those who smoke, you may also want to try to incorporate quitting smoking. Those are some of the things that you may want to do. And then you should also practice simple exercises that are going to help you combat this problem. Now, looking at all of this, you agree with me that erectile dysfunction is not as deadly as some of us make it seem, or as some of us think. If only we can modify our lifestyle, we would see that there are a lot of changes we can bring to our health, and we are going to feel better about ourselves, about our health. Thank you very much for staying tuned, and please, if you have not yet liked or subscribed to our YouTube channel, please do so. For those of you who have already subscribed to the YouTube channel, we encourage you to turn on the notification button so that you will not be left out on our videos. And please do not forget to like and share this video so that others can learn too. Thank you for always staying tuned. Bye bye.